Good afternoon, everyone. Thank you for joining our 2027 self-nomination and QCR measure submission demonstration. This call will be recorded, transcribed, and published on the QPP, or Quality Payment Program webinar library in the near future after this call concludes and all materials can be developed and finalized. So the materials will be available in the near future. With that, I will turn the call over to Dr. Daniel Green to begin our presentation.
Very good. Thanks, Anastasia. Welcome, everyone. So glad you could join us. So hopefully we can help you all if you have questions or issues with respect to self-nominating for next year, aka the program year 2027 QPP reporting. Next slide, please. This is our usual disclaimer that says that the data is accurate at the time we list it, but you should always refer to the rule as the definitive source. Next slide, please. This is just an overview of what we will be talking about today. So obviously the self-nomination information, we'll be reviewing the requirements. There will be a demonstration. QCDR measure submission. So if you are a QCDR and want to submit your measures for consideration, there'll be an opportunity to see how that's done, including the demonstration, and then, of course, resources and a Q&A session. Next slide, please. Okay. So if folks want to participate as a CMS-approved QCDR or registry for the 2027 Merit-Based Incentive Program, also known as MIPS, they have to self-nominate successfully and complete a qualification process. Just to note, as you can see in the margin on the right, the self-nomination opens on July 1st of 2026. It does close at 8 p.m. Eastern Time on September 1st. We encourage you not to wait till the last minute. And just a friendly, by the way, reminder, when you all list email addresses of contact people at your institution, please make sure that they're monitored mailboxes and that these are actually the folks that you're planning to not only read their emails, but actually attend the calls. We've had several instances of people missing calls recently, and it turns out we never received their email contact. We had other people's email contacts from that institution. So let's try to avoid that in the future. Next slide, please. Okay, so other than this demonstration, organizations can download the 2027 self-nomination toolkit for third-party intermediaries. There's a link in the slides. This is located on the Quality Payment or QPP resource library. There's a self-nomination webinar to be scheduled on August 26th from 1 to 2 p.m. for those organizations who are interested to have an opportunity to ask questions related to the 2027 self-nomination for QCDRs and registries. So there will be another opportunity for you all as it gets closer to participate in a webinar and ask specific questions. Next slide, please. So the QPP website, including the self-nomination form, uses HICS, access roles, and profile, so otherwise known as HARP. It uses the HARP system for credential management. So you can register for a HARP account or log into the QPP website to access this. Next slide, please. And this is my clue to hand it over to John Jenkins for the next portion. Thanks. Can we hear John?
Nope. John, you are,
Mike,
there
Sorry,
we go.
I was. It helps if I take myself off mute, doesn't it?
you never sounded better, John.
So anyhow, as I was saying, I'm going to talk about things like, what's a QCDR, what's a QR, things like that, and we're gonna go from there. So, what's a QCDR? And the legal definition is that it demonstrates clinical expertise in medicine, quality measurement, development, collects medical or clinical data on behalf of CMS MIPS eligible clinicians for patients and disease tracking to foster improvement in the quality care provided to patients. That's an awful lot of words for you grab data from the folks that you're representing and you share it with CMS. Next slide, please. So what's a qualified registry? A qualified registry is a data intermediary. Now, the difference between what the intermediary does and what a QCDR is, QCDRs can monitor their own measurements as well. So the registries that they collect MIPS data just like a QCDR, and they submit it to CMS on behalf of whomever they're representing to foster improvement in the quality of care provided to patients. So basically, you're getting information from your clinicians, providing it to CMS, and based on the scoring, you're able to help those clinicians understand sort of where they sit in how they're performing. Next slide. All right, so what are the requirements? So, as CMS approved QCDRs and qualified registries, you're required to comply with all requirements set forth in the 2027 Medicare physician fee schedule. Final rule. And it's detailed at the 2027 QCDR qualified registry self-nomination fact sheet. You can download that from the QPP website. And what do you have to do? You have to support quality improvement activities and promoting interoperability performance categories unless you've been exempted. Beginning this current performance period, which will be the 2028 payment year, QCDRs and qualified registries must support MVPs, or MIPS value pathways, that are applicable to the MVP participant on whose behalf you're submitting MIPS data no later than 1 year after finalization of the MVP in accordance with the current requirement. QCRs and qualified registries may also support the APP, support MVPs that are applicable to the MVP participant. Okay, so it's got to be relevant to their, most of them are broken down by what kind of care do they provide. QCDR qualified registry must support all measures and activities, including the MVP, unless exempted. Now, there are some items that you can be exempted for, and to get those, you would probably be best to look those up in the rule itself. You must also support subgroup reporting. This is likely to become even more relevant in the future, but for now, you at least need to be able to break these folks out into different subgroups. Next slide. Oh, look at that. Supports performance categories, measures, and activities listed on the qualified posting for the entire MIPS performance period and corresponding submission period. So you need to be able to report, and you need to be able to support this stuff for the entire period, not just part of it. You must have at least 25 participants by January 1 of the year prior to the applicable performance period. So the example we've given you here is that January 1 of 2026 for consideration for the calendar year 2027 MIPS performance period. So as of this year, you must have had 25 participants already. That may not necessarily be 25 clinicians, but that is 25 participants. As Dr. Green had mentioned earlier, this has been another sticking point that we have found. We've had some folks recently that in doing our due diligence, we've discovered that for a number of years, they've had less than 25 participants, even though they are attesting during the application process that they have 25. You need to make sure you've got at least 25 participants. Now, is it possible you might not end up with 25 participants? That is a possibility, and there are ways around that. But at least to start the period, you have to have 25 participants. You need to be up and running by January 1 of the performance period to accept and retain data to allow clinicians to begin their data collection on January 1 of the performance period. So essentially, your performance period, this last one started in January. You should have been collecting data effective January 1 until it's expected to come in. You're supposed to submit data to a CMS-specific secure method for data submission, such as the QPP data format. There are others, but as a general rule, we like to follow that. You should submit data on behalf of all payer data. And when I say all payer data, we're not just talking about Medicare Part B claims and patients. This is for everybody they see. Doesn't matter whether the Medicare's paying the bill or not. You need to retain, for the purposes of MIPS, that being the program here at CMS, all records or data for 6 years from the end of the MIPS performance period. So when you submit your data this year, you would need to maintain it, a record of it, for the next 6 years. And you need to comply with any CMS request to review that submitted data. So CMS retains the right, as part of our program, that if we come in and we say, hey, we've noticed something, we'd like to see the data itself, you're obliged as a participant to share that data. Next slide, please. All right, so qualified registry requirements. You have your different types of arrangements, business arrangements, shall I say. You have the business associate agreement. QCDRs and qualified registries must enter into appropriate BAAs or business associate agreements with MIPS eligible clinicians and must maintain records of their authorization to submit data to CMS for the purpose of MIPS participation for each national provider identifier or NPI for whom they submit data. Okay, so you must enter into an agreement that says, hey, you can send my information in. QCDRs and qualified registries must obtain a signed documentation annually to indicate each client has authorized the QCDR or qualified registry to submit their data to CMS for the purposes of MIPS participation. Now, what that means is every year you must obtain signed documentation. This doesn't mean it happens one time and continues on from thereon. You need to have it signed annually, period. As it sits right now, a question has come up about, well, what if it's in our provider agreement? It doesn't matter. Right now, you need to have a separate signed set of documentation every year indicating each client has authorized you to release their data. Next slide, please. Feedback reports. This has been another area of challenge. So QCDRs, qualified registries, you're required to provide performance category feedback on all performance categories for at least 4 times a year. We expect that to be quarterly. And provide specific feedback to all QPP participants on how they compare to other participants. Who've submitted data on a given measure and activity for traditional MIPS, MVPs, and the APP. Now, the sticking point for this has been some folks have been only reporting those people who have had an encounter for the particular measure that they're reporting during that period, under the assumption that, well, you didn't see anybody that had it, therefore your number hasn't changed. You still need to ensure that you're including those people that are not did not necessarily in the last quarter provide or have an encounter for that measure, regardless of where they fall. It needs to go in along with the rest of them. So when we say quarterly, we mean everything gets reported quarterly. QCDRs and qualified registries must certify that all data submissions to CMS on behalf of QPP participants are true, accurate, and complete to the best of your knowledge. This includes voluntary and opt-in participants. Something that has been a sticking point here, and we've seen this as well. You cannot tell your program participants that you're reporting for that you have no responsibility for the accuracy or completeness of data, and then turn around and attest to CMS that the data is true, accurate, and complete to the best of your knowledge. That is incongruous thinking. It has to be one way or the other, or both of them. And honestly, since you can't participate without the data being true, accurate, and complete to the best of your knowledge, that's how it should stand in your arrangement between you and whatever clinicians you're representing. Next slide. All right, access to data. So CMS policy prohibits non-U.S. citizens from accessing CMS information technology systems, and also requires all CMS program data to be retained in accordance with U.S. federal policy. Specifically, the NIST publication 800 text 63. It outlines enrollment in and identity proofing requirements, essentially levels of assurance for federal IT system access. Access to the QPP would necessitate passing a remote or in-person federal identity proofing process. That is an Equifax proofing process or some equivalent there. And just so you know, all of us here, we have to go through it too. So it's not like it's something that we're expecting extra of you. It's just to access the data, we need to make sure that it's unlikely that somebody would use it for, well, inappropriate purposes. Next slide. Data validation. This is where we find a lot of the things that may have been missed from application to the end of the year, because we randomly select some data validations to audit at times. And in doing that, that's how we find many of these issues. So during the self-nomination, QCDRs and qualified registries submitted a data validation strategy for CMS to review and approve. So you've sent us a strategy that says this is how we're going to validate our data. We're expecting you to follow that, not change it mid-cycle. And basically, it explains your entire process of quality improvement activity, promoting interoperability data submitted to CMS. QCDRs and qualified registries must conduct the data validation for the 2027 performance year prior to any data submission. So you should have checked and validated your own data before you send it to us. This isn't an after the fact kind of thing. That data validation must include all performance categories for which you will submit data, and each submitter type for which you will submit data, regardless of whether the clinicians or groups are MIPS eligible, voluntary participants, or they're opting in. The 2027 data validation execution report with the results of your data validation audit must be submitted to CMS no later than the 31st of May, 2028. And I can tell you, CMS has already reviewed the data validations that were audited for the year. So just so you're aware, we do actually do it. It's not, it just comes in and goes in a circular file somewhere. We actually do look at them. Next slide. All right, training and support sessions. QCDRs and qualified registries must attend, and I repeat that, must attend and complete training and support sessions in the form and manner and at the times specified by CMS. Remedial action up to and including termination as a third-party intermediary may be imposed to training and support session absences. We're not complete heartless ogres over here. There are times that something happens as an emergency, and we do take that into consideration. But if you're demonstrating a lack of concern about being here to have changes explained to you or to share information through the question and answer sessions, you're also demonstrating that it's questionable what might be the level of competence with respect to doing your data validation, for example. So we take it very seriously. We host a series of trainings that consists of an annual kickoff, monthly support calls, virtual office hours. The monthly support calls and virtual office hours are basically for us to field questions or inform you of changes in deadlines, changes because there's been a legislative mandate that came out that forced a change to one of our policies, things like that. And when you miss those, you're missing out. So for additional information regarding the training and support session schedule and requirements, a 2027 QCDR Qualified Registry training and support session flyer will be distributed to all CMS approved QCDRs and qualified registries. Next slide, please. Remedial action and termination. CMS has the authority to impose remedial action or termination based on the determination that a third-party intermediary is non-compliant with one or more applicable criteria for approval, has submitted false information or certification, has submitted data that's inaccurate, unusable, or otherwise compromised, not maintain current contact information for correspondence, or are on remedial action for 2 consecutive years. Again, we're not heartless ogres over here, but there does get to be a point in time where if we're having the multiple issues with a particular third-party intermediary, we have to be able to rely on that we are providing accurate information back to the people in this country, because most of our reports are public. And in order to do that, we need to make sure that the rules of the program are being followed. So failure to comply with remedial action process may lead to termination of third-party intermediaries for the current and or subsequent performance year. Third-party intermediary is terminated. A transition plan must be submitted by a date that we specify to ensure that your clinicians that you have been supporting aren't left out in the cold, so to speak. We need to make sure that they're covered. We need to make sure that if there's a measure, well, how's that going to get stewarded? Things like that. So, next slide, please. Data integrity. So we further evaluate you guys to determine if any additional inaccurate, unusable, or otherwise compromised data has been submitted. Now, does that happen because of transmission error? It is possible. Sometimes things get corrupted in transmission. Data inaccuracies may lead to remedial action, termination of a QCDR or qualified registry for future program years based on CMS discretion. One thing on that, we have had a number of folks that have in the past been terminated, come back, just same folks as the primaries and a different name. We do check things like that to make sure that we're not getting the same people, just under a different name. CMS will evaluate data submitted for quality measures for data completeness and accuracy. The QCDR qualified registry will also certify that all data submitted, including quality measures, improvement activities, promoting interoperability objectives and measures, are true, accurate, and complete to the best of your knowledge. CMS will determine error rates calculated on data submitted to CMS for QPP participants. Like I said before, you're having to attest to us that the data you're submitting is true, accurate, complete to the best of your knowledge. So you need to take responsibility for the data that you're sending to us, because you're telling us that it is true, accurate, and complete. Next slide, please. Oh, look, it's Anastasia's turn. Anastasia, got something to say?
It is my turn to do the live self-nomination demonstration. Bear with me one moment while I change the screen here over to the actual demonstration. Okay. Now you should be seeing the Quality Payment Program website on your screen in the webinar. This is just the home page that I have displayed at this moment. I just wanted to use this screen real quick to indicate that in order to self-nominate, you sign in on the QPP website. So there's a sign-in option right where my mouse is in the upper right-hand corner. Once you hit that sign-in button, it'll take you to the next window where you need to use your username and password. If you already have an account, great. If for some reason you need to register for an account, there's a lot of helpful information here. Not going to spend time today going over that, but of course there's a user guide as well as additional information here in relation to generating an account for you. So definitely register for that HARP account that was referenced earlier. With that though, I am already signed in on my next window here for the purpose of this call. Once you have an active account, once you are able to log into the system, you will be able to self-nominate. Now, of course, here we have the 2027 self-nomination homepage. I have several tests here that are loaded up and pre-ready to go over through the webinar today, but I do want to cover a couple of higher items that we need to chat through real quick. If you are an existing 2026 QCDR qualified registry that is planning to continue participating for 2027, you do have to self-nominate again. If you are existing, you will have a template already out there for you. If you are an existing vendor in good standing, you will have what we call a simplified form, which will actually have a lot of your information pre-populated for you. So that's super helpful. Highly recommend using that if for some reason you do fit that scenario. If for some reason you are an existing intermediary that perhaps is on a corrective action plan or something to that effect, you will still see a template out there, but we have not gone through the process to repopulate that information for you, as you do not qualify for a simplified form. So we do just want to note that if you are existing, please make sure to use those existing templates that are out there already for you, because those are tied to your unique intermediary ID that is, of course, used for submission. And so we want you to make sure that you are continuing with that same ID. On that note, you will see underneath the screen here, like I said, I've got several samples that I'm just wanting to detail out a little bit. Some organizations do participate as multiple intermediaries, perhaps multiple QCDRs, or perhaps a QCDR and a qualified registry. Each individual intermediary does require a self-nomination. So please make sure you are submitting a unique self-nomination for each one you do plan to self-nominate for. If you are in the process like I've shown here on the screen, we've got a couple of various processes. We have a draft in progress, a draft in progress, as well as a draft complete, and then a withdrawn status. This will show how you are doing on your self-nominations that you're planning to submit for the performance period. So you can see I have one that's 70% complete, one that's 100% complete, and then one that we've just withdrawn as if for some reason you decide to self-nominate, change your mind, you can always withdraw that, and you can see your status of that particular self-nomination. Now, if for some reason you do need to add a new self-nomination because your a new organization that would like to self-nominate for the first time, when you log in here, you won't see those rows at the bottom there. Instead, you will have to add your new intermediary. You will need to enter your intermediary name, as well as to select if you are a QCDR or a qualified registry. So you will need to do that again. Just definitely highly recommend if you are an existing vendor, make sure that you do find that simplified form or that template that's existing to tie to your existing vendor IDs. If you're new, of course, create a new intermediary out there. That way we can review your self-nomination. Now, what I'll do next is go into these self-nominations, starting with the top one here. For the purpose of the demo today, I am going to use the QCDR version of the self-nomination. There are minor differences between the QCDR version and the qualified registry version, but as the QCDR version has additional fields that the qualified registry does not, I just want to make sure we go through that. I will note when there are fields that will only apply to the QCDRs though. So jumping into our first self-nomination here, as you can see, there's all sorts of information we collect during self-nomination. This first instance here is in relation to your contact information. We obviously need your QCDR name, which is what you typed in when you created your new intermediary or when you populated your self-nomination form initially. If for some reason you do need to change that QCDR name, which is right here, then you will use the pencil to go ahead and edit that intermediary name. Additionally, we do have this Manage Watchers option up here. That is actually an option for if you've started a self-nomination, you can add additional folks within your organization that have the appropriate account, the ability to help you manage your self-nomination. Highly recommend having somebody there as a backup in case you are out of the office, perhaps lose access, anything to that effect. It just is always a good idea to have at least one, more than, at least two, if not more, people that have access to the self-nomination form so you don't miss some type of a deadline or something to that effect. We also have options to print. And then we have a comment section that we use. Now, we do use this comment section a lot within reviewing your self-nomination. I will show you here. If you do have a question for us, or if we have a question for you, request updates, anything to that effect, we will use this channel right here to communicate that information. So we highly recommend you pay attention to your self-nomination and observe any type of questions that are coming through. If a question is posted, you will get an email that a question has been posted or a comment has been posted. So, if you see those emails, please make sure to check that out as soon as you can. That way, if for some reason there's something additional that's needed from the self-nomination perspective or perhaps a QCDR measure perspective, we can get that resolved right away. So I will just show you real quick. If you do want to add a comment, you of course hit the Add Comment button. We do have subject lines for all of the high-level tasks that we complete within this tool. So if for some reason you're asking a question about self-nomination, we ask that you use the subject line self-nomination to convey that that's what this is being discussed. We have various people that are working on these self-nominations, so flagging if something perhaps is self-nomination related versus measure related is extremely helpful. I'm just going to select self-nomination for the purpose of the demo today and just to type in, let's see, I don't know what happened there. My apologies. Here we go. Just going to type in test here. And then you can see you can attach files. So if there's something you need to share with our team, you can attach a file. And then in addition to that, you will just click send. As you can see here, then you have a running log of what questions have come up. And again, you'll get an email saying that I have posted a comment within your self-nomination. There is an option to filter those. So just like I had asked you to put those subjects in there, you can certainly sort to those subject topics as well. So if for some reason you're looking for a response related to QCDR measures, then you would come in and select QCDR measures for that option. All right, closing out on the comments here. We also do have a section in here that says guides and help. So with that, we have a lot of helpful information that is available on the QPP resource library. But in addition, we link to them within this self-nomination form. So we do have the instruction information, which, of course, I'm not going to go and read to you today, but helpful information for you to know more details about what we're going over today. In addition to that, the resources, which includes a self-nomination user guide, as well as a QCDR and qualified registry fact sheets. And then if you are supporting QCDR measures, highly recommend familiarizing yourself with all of the information within the handbook. So we do have helpful resources within those, within that link at the top there for your reference. Now, where it comes to actually populating the self-nomination form and all of the content that we need, we have a simple format of how our information is displayed within the format. We have a left navigation pane, which will obviously be discussed throughout the demo today. And then you can also see there are similar icons like there was on the homepage when we logged in. If you see the circle that is half filled and yellow, that just means that tab is in the works. If you see the tab or the icon of just the empty circle with the dots, that means that that tab has not started yet. If you see the green checkbox, that means that that information and everything that is needed on that particular tab has been populated. So you can kind of see where you still need to do some work or where you have already wrapped up. With that being said, I will note that we'll go through these one by one. And I've already populated a lot of test information, so it's easy to jump through the entire self-nomination today. So you'll see just some random test information throughout some of these fields here. But starting here, the first section, we do that contact information. We want to make sure we not only have your QCDR name, but your organization name if for some reason those are different. In addition, if you do have any type of partnership or collaboration, whether it is a partner for something clinical or something technical, we do ask that you put any of that information in these fields. We want to make sure we know all organizations that are assisting your organization with doing the activities as a QCDR or qualified registry. We also get your tax identification number and then ask if you're planning to submit a self-nomination as both a QCDR and a qualified registry. So if you plan to be both intermediary types, just click yes or no. Intermediary staff access. This field right here is actually similar to the eyeball icon that I had shown you earlier. This is where you can add additional staff you would like to have access to this self-nomination. Again, they do need to have the appropriate account to be able to access. The next section is just the higher level contact information or demographic information for your organization, address, phone number, website. And then the next section on this tab actually contains information that you need to fill out for your contact list for your particular QCDR or qualified registry. Now, we do collect a main program contact, a main clinical contact, as well as a technical contact, just because there are times when we really need to speak to, the clinical person or the technical person. With that said, we do include an additional option here to add any additional folks you want on the distribution list. So you have to provide at least 3, but you can certainly provide as many as you want. We understand that it is helpful for organizations to have multiple contacts on our distribution list just to ensure that no deliverables are missed, calls aren't missed, and things like that. So whoever you would like to receive the communications from CMS regarding your QCDR or qualified registry, please make sure all of those email addresses are on this tab prior to you submitting. If for some reason after self-nomination you do find that you need to add or update any of this, you can certainly let us know and we'd be glad to update it for you. With that said, I will move on to the next tab, which is intermediary details. Intermediary details is just collecting information that will be specific to your QCDR or qualified registry. For example, what kind of an intermediary are you? Are you a health IT vendor, a specialty society, or so on? You'll just select what makes the most sense. Of course, if you do select other, you do need to type in a description for that. We also request information as to whether or not you have participated in MIPS or PQRS in the past. I have new selected right now. However, if for some reason we do have an existing vendor, then they do need to click existing and let us know when exactly they did participate. So you would certainly just select the years. I do want to know if you are an existing vendor and you have participated at least 2 years, there are additional fields you will need to populate, as you've seen that have popped up here. So this next option is just asking if you have participated those last 2 years, since of course, based on the drop down, we have that this person has participated the last 2 years. The yes option is grayed out there a little bit because you've already indicated you've participated 2 years. And then it asks you if you have submitted data. One of the requirements to participate as a QCDR qualified registry does ask that you submit data throughout your participation. So we do have a rule of information or data needing to be submitted at least once within the 2 preceding years of your self-nomination. So if you did not submit any data, you will be required to submit a participation plan. Now, that participation plan should include information as to how you, as a QCDR or registry, are planning to encourage your clients to submit data in the future. So keep in mind that you will need to submit a participation plan if you are an existing vendor and you have not submitted data within the last 2 performance periods. I am going to just make that easier and wrap those back up here. The next section is just if you're using any kind of alias, acronym, anything to that effect. We have a lot of entities that use various acronyms, and if we are not familiar with those acronyms, sometimes it's hard to tie your organization back to a specific QCR or qualified registry. That happens a lot with the support calls that we do host. We'll have individuals use names that we are not familiar with, and it's hard to mark folks in attendance for calls if we can't quite track it back to a specific QCR or qualified registry. So if you do have other aliases, acronyms, anything that you may go by besides what we have already previously included in the self-nomination, just go ahead and put it in there. I'm just going to, for the point of this, indicate that we're not using an alias, just to wrap that field up. The next section will be both for QCR and qualified registry, where you'll select what kind of specialty you are. We understand there's a lot of organizations that support all specialties, but we also have very specialized organizations participating as well. So it perhaps may just be cardiology or something to that effect. The next one is whether you plan to submit QCDR measures. I'm going to briefly go into this, but we will have a QCR measure demonstration in the near future after an additional presentation. So it'll just be coming in later on in this call. If you do plan to submit QCDR measures, then you'll click yes. If you don't plan to submit QCDR measures, or if you're not a QCDR at all, then obviously you won't select yes there. As a qualified registry, you won't even see this particular field within your self-nomination. So I just do want to note that if you click no, nothing happens within the self-nomination. However, if you do plan to submit QCDR measures, the QCDR measure tab pops up here on your left nav pane. So once you click yes, that option will display. If you clicked no, then you do not have the option to submit QCDR measures. So again, that information will be detailed out later in this call. The next several fields here are in relation to a definition of a QCDR. As mentioned earlier, QCDRs do require additional skills or abilities within your organization, including clinical expertise, measure development experience, and things like that. In this section of the self-nomination is where we collect that information. When we evaluate new QCDRs, we really look through this information that you provide to make sure that the necessary expertise is located, within your organization. So please be as detailed as possible in these sections to ensure we understand all of that experience that you may have that will attribute to you being a QCDR. With that said, that brings us to the end of this particular tab. And you can see we've populated everything on this tab, so the check mark now displays. Moving on to the next tab is the qualified posting details. Every year after self-nomination, we do post what we call a qualified posting on the QPP resource library. This information on that public posting will be pulled directly from this particular field. So we ask that you make sure that as you're typing things in here, as well as honestly the rest of the self-nomination tool, you are making sure that your grammar is correct, your spelling is correct, all that kind of stuff. We would hate to post something on the website from what you've put in your system without, without doing a spell check or grammar check, things like that. So we do ask that you make sure what you put in this field is exactly what you would want displayed on the CMS website. In addition, there are some minute requirements that go along with some of this information. Like the cost information, you are required to tell us how much you charge your clients for the services of MIPS submissions. With that said, we do ask that you try to detail it enough to say, it may be X amount of dollars for, each clinician per year. Others may charge per month. Others may charge per group. Whatever those details are, we do ask that you include that in there. And if there are any differences for different services, perhaps there's one fee for traditional MIPS and a different fee for MVPs, any of that type of detail does need to be included in here. The next field, you will just make sure that you indicate what services you do provide for those costs that you're charging. The next one is just a drop down here to select on a calendar what your last date of accepting new clients will be. Now, this is for the 2027 performance period. So data submission ends on March 31st of 2028. So you would want to work with your organization to see when is the last possible day I can accept new clients while ensuring all requirements are met, like validation, the ability to accurately collect that data, aggregate it, submit it, things like that. So wherever it is, that last day that you plan to accept, you can certainly just indicate that here. And then folks looking at the qualified posting can see, oh yeah, these guys are still accepting new clients, or maybe you're not. I'll put in just a random date here. And the next section is talking about reporting information. This first field is just how do you collect your data? Are you just using one method, or maybe all of these, or perhaps another one that's not even listed? We just want to know how you are collecting that information. For the purpose of the demo, I'm just going to go ahead and select one. Then we have performance categories. As John mentioned earlier, it is a requirement that all of our QCDRs and qualified registries support all of the performance categories. You can see quality and improvement activities are grayed out here, so you do not have the option to remove either of those, as you must absolutely submit quality and improvement activities. Now, promoting interoperability, you are still technically required to support that as well. However, there is a promoting interoperability exception. There are detailed information related to that within some of those resources I discussed earlier. So if you feel like you meet that exception, please review that documentation and ensure you do or not. But if you do, you will have to select that you did meet that exception. And then, of course, provide the reasoning as to why or how you meet that exception. For reporting options, we just want to know which of these you're planning to support. As you can see, MVP is actually a default selection as yes in there. Again, that was referenced earlier, our QCDRs and qualified registries are required to support MVPs. Now, again, there is a little bit of a exception there where, if for some reason there's not an MVP that supports the clients that you support, perhaps your specialty is not available as an MVP, then again, there is an exception here. Outside of meeting that exception, if you don't, you are required to support MVPs. If you do meet that exception, just like with the last option, you do have to click yes to say you met that exception, and then indicate how and why. The other two options, of course, are for the APM performance pathway and the traditional MIPS. You will just select all of the ones that you plan to support for the 2027 performance period. And then participation options. You are required to support subgroups if you are supporting MVPs. So if you do select MVPs, we will expect that subgroups are indicated there. So you will see options that will need to, be addressed if for some reason you are not selecting one thing that is required per another part of the self-nomination. And then we have other options here. If you do select virtual groups, you do have to select the virtual group specialty. So any of those specialties you plan to support for your virtual group, we will ask that you put that information in this particular field. I am going to unselect that, and you can see that all of my fields on this particular tab have also been completed, so I have the green checkbox. Moving right along to the next tab is attestations. Now, I'm not going to review all of these one by one, as John addressed, I believe, all of these during his presentation. And of course, you are welcome to review these in more detail on the self-nomination form, or of course, in our resources that are published on the website. With that said, you'll find that there's only an option for yes underneath all of these, as you must attest that you meet all of these particular requirements within the self-nomination tool. If you do not meet one of these requirements, you do not meet the requirements to participate as a QCDR or a qualified registry, so you would not be able to self-nominate. Once you've reviewed all of those requirements, as well as selected yes, then we just ask that whoever had reviewed and selected yes on that types their names in this particular field. That way we know who it was that reviewed all of those requirements and ensured, attested to the fact that, yep, we meet all of these. So we will just type in a name here. All boxes have been selected as yes. I typed in my name, and so we have the green checkbox. Moving on to the improvement activities. We have actually a couple of these next tabs. So the improvement activities, promoting interoperability, the MIPS CQMs, the ECQMs, the MIPS value pathways are all set up very similarly with minor differences. So I want to group some of the functionality together rather than covering it individually on each tab. So as improvement activities is first here, we'll just address that, and then I'll tailor the differences in the upcoming tabs. So we do require that you let us know which improvement activities you plan to support for 2027. Now you'll see there are only options for all and some, because as a QCDR qualified registry, again, you have to support improvement activities. We do include additional information related to the improvement activities, and we do note that as the 2027 physician fee schedule final rule has not even been proposed, let alone finalized at this point in time, these lists in this particular self-nomination is based on the 2026 list. Once the final rule for 2027 is published, we will give any QCDR qualified registry an opportunity to update these lists. So if for some reason there are new activities or measures that are finalized in the new rule you would like to add, you will have the opportunity to do that once the final rule is available, and additional information will be communicated when that happens. I do just want to note that if for some reason there are also improvement activities or measures that are removed during the final rule process, even though you selected it during self-nomination, those will obviously be removed from your list of 2027 measures and activities you're supporting, as they will no longer be in the program. So again, you can select all, or for some reason you're only selecting a handful, then you can go through here and select each of the improvement activities you plan to support for that performance period. So we will just click a couple here and to show you how it does. Once you've selected those, they will pop up in a list in a box below. And then you can, quality assurance check your own work there to make sure you've got all of the improvement activities you plan to support for the year. If for some reason you need additional information related to those improvement activity IDs or what those activities are in relation to, there is a link on this particular tab that will direct you to additional information related to the improvement activities. I'll go ahead and move to the next tab here. Like I said, these tabs are very similar, so the options are exactly the same, with the exception that the none option is available on this particular tab, because as I discussed before, there is an exception for QCDRs and qualified registries that may be exempted from supporting promoting interoperability. So if you do have that exception, we would expect a none in this field. However, of course, if you do not meet that exception, we would expect that you would either support some or all of the promoting interoperability measures. Outside of that, everything is exactly the same within this particular tab, as I mentioned in the improvement activities. And similarly, the registry is a little, the CQMs are the same. So there is a little more content at the top because there are some requirements in relation to this tab that we do. I just want to make sure folks are aware of. Like, for example, QCDRs and qualified registries must have a minimum of 6 quality measures they support for the performance period. At least one of those has to be an outcome measure or a high priority measure. So we do include some additional information on this tab in relation to that. We also include information related to the Medicare CQMs. So you'll see that information in the instructions as well. I do want to note, obviously, your options here are the same. You get the all, the some, or the none. I do want to just select some to display how the difference between a MIPS CQM and the Medicare CQMs display within the tool. So we do have quality ID 001 for, of course, measure number 1 for CQMs. But then you can see we also have 001 SSP, which of course would be the Medicare CQM. So please make sure you are selecting both of those particular entries for measure 1 if you are supporting both the MIPS CQM and the Medicare CQM. Moving right along, we will go to the MIPS eCQMs here. The options, again, exactly the same. So you will select all, some, or none. I've selected none there, as for the purpose of this self-nomination, I've planned to support CQMs. The next tab is very similarly set up, but does require a couple of additional steps. So we do have a lot of the same information, as you can see at the top, and additional directions based on what you're going to do on this particular tab. As I mentioned, it was just a little bit different than the others. So you will see there is MIPS value pathways options to select all, some, or none. And you can see I've selected 2 already. If, of course, you're selecting all, then all will display. If you are selecting some, then again, you will select which ones you are planning to support for that particular performance period. And none, again, only if you meet that exception should you be selecting none. But we will just do 1 here. If you are supporting MVPs, you will see things pop up below that particular field. As you can see here, I have selected Advancing Cancer Care MVP, and the options to select which CQMs, eCQMs, and QCDR measures have displayed underneath of it. Now, if you are a registry, a qualified registry that is, you will not see the QCDR measure option, as again, qualified registries cannot support QCDR measures. So for any MVP that you do plan to support for the performance period, we will ask that you go through and select which of the measures you plan to support for that MVP. As you can see in the drop down here, you can easily select all if you're doing all. You can do none if you're not planning to do any CQMs for this particular column. Or you can select which measures within that particular MVP you plan to support. And the same applies for eCQMs and, again, QCDR measures if you're planning to be a QCDR. Now, I do want to note, if you are planning to be a QCDR and want to support QCDR measures within an MVP, you must obtain permission from the measure owner to be able to support that QCDR measure. So please make sure that the necessary permissions are obtained prior to the end of self-nomination. The next tab is in relation to the data validation. John did discuss this a little bit within the presentation, and there is detailed information within those resources on the resource library if you do need more information. But in this section, we do ask that you provide detailed information regarding how you plan to validate all of these items within your data prior to submitting to CMS. So we do ask, how are you going to verify your eligibility of your clinicians? How you're going to make sure the tax identification numbers and NPIs are accurate. How you're going to validate to ensure that the data completeness rates and performance rates are accurate and the data you're submitting in relation to those rates is accurate. We also ask you to make sure that you are only using, of course, the 2027 specifications for any type of measures and activities you're supporting. As I'm sure many of you know, some of the specifications do change from year to year, and that our systems and the data you're submitting incorporate those changes every year. So we do want to make sure that you are ensuring that your systems or whatever it is you're using are being validated to ensure that only the 2027 versions or specifications are being followed for those particular MIPS submissions. In addition to that, we do require a data validation audit. More detailed information can be found within the resources as well. We also require the minimum of 3%, as you can see here in the tooltip. The information within that tooltip is the minimum you must do within the data validation audit. So we do ask that you ensure when you're populating this field that you at least accommodate that information. Should you wish to do more, of course, that is absolutely acceptable, but that is to your discretion. Please make sure, though, at a minimum, you are meeting what is listed in this tooltip. And the same thing for the targeted audit. There are specific requirements and thresholds required within this as well. So at a minimum, similar to what I said to the last field, you must complete these steps for validation. If you'd like to do more, you're certainly welcome to do so. And the next item here, benchmarking capability, is required. So if you click no on this one, we will come back to you and say, we need that updated. If you are unable to benchmark, you're unable to be a QCDR qualified registry. So we do just ask that you put yes there in order to be one of our intermediaries, and then you can either drag and drop, or you can browse your documentation to put that file within this particular field. So we do that. I'll just show real quick. Yeah, just dragging and dropping. I can show you my attachment has just been put in there. And as you can see, the file has been uploaded successfully. It also shows you when it was uploaded in case there are instances where you've uploaded something, but you need to upload something else, or there's multiple versions of something you need to select. So there is additional information related to when something was uploaded and by who. Okay, so with that, that is actually the last tab within the self-nomination. I wanted to just show, though, as you can see, as I went through today, I went and made sure everything was green, except for this just last one, just to show. As you can see here, it still says draft in progress, and that's because we still have one guy here who has not been completely populated. So if you see any of these yellow half-filled circles or the circles with the dashes, you will not be able to submit your self-nomination. As you can see here, it shows me exactly what I did to not be able to submit my self-nomination yet. I had one field that is required, but I have not populated that information in. I have not entered the emails in for these organizations at this point in time. So if I just go and do that real fast, these fields will, apologies, once they're filled, we'll turn that cell into green. And then at that point in time, you will see that your form is actually 100% populated. And then we will be able to actually submit the self-nomination for review. So once I fill out the remaining fields, here we go. As you can see, now we have absolutely everything filled in here. We've gone through our self-nomination, through all of the tabs, ensured the information is accurate. I would always highly recommend everybody take one more look through there, just make sure everything is accurate. And then once everything is complete, you've got a status of draft complete, and you can hit that submit for review button. And then, of course, it makes sure you want to submit. If you do, of course, go ahead and submit it. And then that's where we step in and we take over and review your self-nomination. Again, in that comment box in the tool, if for some reason we have questions or we need something updated, we will communicate that information there during our review cycle. So pay attention to that. And then we'll continue to work through the self-nomination process until we're able to hopefully accept your self-nomination. With that, the demonstration of the self-nomination is done. So I'm going to pass the screen back to the next portion of the presentation. There we go. And Marlene from the Pick'ems team will be taking over.
Hi, good afternoon, everyone. This is Marlene from the Pick'ems team, and I'll just be reviewing some of the QCDR measure requirements for the 2027 self-nomination. So first, for your QCDR measure to be approved, the QCDR measure should be beyond the measure concept phase of development. The measure should address significant variation in performance, and you'll be expected to submit evidence of that performance variation in your form. For first year measures, you will need to submit face validity testing and then plan for the measure to be fully developed and tested for subsequent years. As I just mentioned, because we need the evidence of the performance variation, you will be expected to have performance data collected prior to self-nomination. And finally, the measure cannot be duplicative of another measure that's already in the quality measure inventory. Next slide. QCDR measures should assess a meaningful quality action for the numerator component. The quality action should be evidence-based and supported by recently published clinical guidelines or recommendations. At the time of self-nomination, QCDRs must link their QCDR measures as applicable and feasible to at least one of the following. So a cost measure, an improvement activity, or an MVP. If a QCDR measure doesn't have a clear link to a cost measure, improvement activity, or an MVP, CMS may consider exceptions if the potential QCDR measure otherwise meets the QCDR measure requirements and considerations. So, for example, if there isn't a link to a cost measure because the specialty isn't reflected in the current inventory, the QCDR would then indicate within the self-nomination form that there were no cost measures related to their QCDR measure. Once submitting a QCDR measure, it is important to emphasize the move toward outcome-based measures and MIPS. So on this slide, there are different outcome measure types listed. For example, there's the patient experience of care. This type of measure focuses on the potential to improve person-centered care and family or caregiver experiences. There are also patient-reported outcome-based performance measures that are based on data that is collected directly from the patient using a PROM tool. And this PROM tool can be an instrument, a scale, or a single item measure. There is preference or consideration for measures that allow the use of more than one PROM tool in order to complete the quality action. And then finally, there's also the intermediate outcome measure. This measure assesses the change produced by healthcare intervention that leads to a long-term outcome. And for more information on these measure types, we encourage you to use these links that are on the slide, which will direct you to the MMS Hub website. Next slide. So as I mentioned earlier, you must collect performance data prior to self-nomination. QCDR measures that demonstrate room for meaningful improvements and show variation and a performance gap are preferred. Measures that have high performance rates with limited value for reporting will be considered for rejection, as these measures are no longer driving care. And measures that may fall under this bucket include those that meet the topped-out definition and measures with limited scoring potential. Next slide. QCDR measure testing. So this is also a requirement for measures being submitted during self-nomination. For a new measure in its first year, the minimum requirement is face validity prior to being self-nominated. And then in subsequent years, you are expected to submit accountable entity level or measure score level validity testing and reliability testing. You're also expected to submit patient and or encounter level data, and this can be either reliability or validity testing of those data elements. And you'll also need to submit feasibility. One important thing to know with the transition to MVP reporting, a QCDR measure must be fully tested prior to self-nomination to be considered for inclusion within an MVP. Next slide. So thinking about the measure concepts that you plan to submit, CMS does have a goal of reducing the overall measure inventory. And so we highly encourage QCDRs to perform an environmental scan for similar concepts, whether it be in prior or current measures that are in different CMS programs. This includes like looking at similarities in the patient population, the clinical action, specialties, and care settings. If a new QCDR measure is submitted and is similar to an existing measure, CMS will not approve both measures. So QCDR should either one, obtain permission to use the existing QCDR measure, or two, you can collaborate with the other QCDR to resolve areas of duplication and develop a comprehensive multi-strata or multi-performance rate measure. In the event areas of duplication are not resolved, then the most robust of the duplicative measures will be approved. So looking at multiple strata and multiple performance rate measures, so typically these are measures that contain multiple denominators or patient populations, or they may assess for multiple quality actions along a care pathway. And so there are different ways that these measures could be structured. The first way is a multiple strata measure. This is one there are multiple strata in the measure that are calculated internally by the QCDR, and then there's only one overall performance rate that is submitted to CMS for reporting and benchmarking. Or alternatively, if all the strata are required to be submitted to CMS, then that would make the measure a multiple performance rate measure. So in that case, the QCDR would submit all performance rates to CMS, and CMS will calculate the final rate via a simple or a weighted average. Or there's also the option to specify a specific performance rate that will be indicated in the form as the overall performance rate. We encourage QCDRs to carefully review specifications to identify if there are multiple strata or multiple performance rates that need to be submitted, and which performance rates will be used for reporting and benchmarking. All right, so looking at ownership of QCDR measures, only QCDRs that are approved and active are eligible to own a self-nominated QCDR measure. In the event a QCDR is no longer participating and becomes inactive, you can allow for the continued use of the QCDR measure. You would just have to transfer the measure ownership and rights to an active CMS approved QCDR that will continue to support the measure for the MIPS performance period. The new QCDR measure owner must also provide medical and measure expertise to be able to amend or manage the measure, and the new measure owner can permit other QCDRs to use the measure. So in the event a measure is co-owned, and the co-owner is not an active QCDR, but rather a partnership or a collaboration with an external entity, then the active QCDR must still indicate in the self-nomination form that the measure is co-owned, and will indicate the co-owner when indicated. And I believe there'll be a demonstration on where to complete that piece as well. So the co-owners should also be identified within the QCDR name, and we also expect them to be listed under the partnerships or collaboration section in the intermediary details tab. So again, you are welcome to co-own a measure with another entity that is not an active QCDR, but the active QCDR must submit the measure during self-nomination and must indicate the co-owner within the QCDR name, under the partnership or collaboration section, and also indicate the measure as co-owned. For QCDRs that are borrowing a measure, permission must be submitted and granted at the time of self-nomination so that the QCDR borrowing the QCDR measure can include written proof of permission for CMS review and approval. And so to conclude this part of the presentation, we have this slide here that summarizes the most common reasons that CMS rejects measures during self-nomination. These include duplication of current or retired measures, resubmissions that didn't address CMS feedback from the prior year. So, for example, if CMS requested revisions, this should be reflected in the new submission, or a rationale should be submitted to justify why the change was not made. As I mentioned earlier, if the measure has high performance rates, we may consider it for rejection. If you are missing evidence showing that there's a performance gap, measures with low adoption and therefore are unable to establish a benchmark, checklist style measures without a real clinical action, standard of care, low bar measures, attribution issues. Again, this is not a complete list, but just highlighting some of those most common reasons for rejection. And with that, I'll turn it over to Stacy, who will walk through the QCDR measure submission demo. Thank you.
Thank you, Marlene. Just bear with me for a second. I'm going to share my screen. And if you can just verify that you're able to see the self-nomination form.
Yes, we can see it.
Okay, great. Thank you, Marlene. Okay, so we'll go ahead and take a look here. You've now seen the process of submitting your self-nomination form as a whole. So I'm just going to be specifically walking you through how you will self-nominate your QCDR measures if you plan to do so. This year, we did not have to make any substantive changes to this QCDR measures tab, so it should look very similar to last year's. So as we get started, as Anastasia had previously mentioned, when you enter your self-nomination form, you may not always see the QCDR measures tab active over on the left navigation pane. And to activate that tab, you need to begin in the intermediary details and about halfway down. There is a question under the QCDR details if you plan to submit QCDR measures. So I have it selected as no, therefore it remains hidden. But if you change that to yes, you will see it pop up here on the left side. So quick, just before jumping into the QCDR measures tab, just another reminder, Anastasia did show this, but the submit for review, withdraw and reject buttons you have here at the bottom left, those are specific to the self-nomination form as a whole, and any activities submitting the measures to CMS or withdrawing, those will be done directly within the QCDR measures tab. So this is our QCDR measures landing page, and it just starts off first with just a couple reminders. The QCDR measure submission should only be filled out by those who meet the 2020 definition of a QCDR and are self-nominating as a QCDR for 2027. QCDRs can submit a maximum of 30 QCDR measures for CMS's consideration. The QCDR measure tab, once the self-nomination period closes, this will lock down and there will not be any further changes to the measures within this tab. All of those updating and measure changes that we complete later on in the process will be done outside of the self-nomination form. And last, if you plan to support a QCDR measure that's in an MVP, in addition to including it in your MVP tab, you do need to include it with all of your QCDR measures that you're submitting to CMS. So you'll see here at the bottom, we do have 3 different statuses or folders that will be available at all times. The first is the submitted status, and this should include all QCDR measures that you want CMS to consider for potential implementation. And these must be in here prior to the close of the self-nomination. Next is the draft status. And as you start manually adding measures, this is where you'll find them if you work on them, save it, and go back to it at a different time. They will be housed here in the drafts folder. Additionally, for those QCDRs that have participated in the past and are in good standing, you will receive a simplified form. And so this means that all of the approved QCDR measures that you're reporting for the 2026 performance period will be pre-populated within the drafts folder. Just keep in mind, most of the information is pre-populated, but there will still be some fields that will need your attention. And then last is this non-active status, and this is where measures will go if you no longer wish to submit them. Maybe you started a measure and decided that you don't want to submit that to CMS, and you'll withdraw it and it'll remain in this non-active status. Again, just a reminder, all measures that you do want CMS to review must be in the submitted status at the close of the self-nomination. Anything left in the non-active status will not be submitted. So we'll just take a look at a draft measure first. Once you open the draft folder, I have a test measure here, and you will go to the side under actions and you'll select edit details. And as we open the measure form, here at the top, there are 4 sections that are required to be populated before the measure can be submitted to CMS. This includes the measure information, analytics, testing, and supporting documentation. There's circles, as Anastasia showed, with some of the other fields that will show your progress. So once that section is fully completed, this will turn green with a check mark. So you'll know, what area you may still need to fill in some required information. All the required fields will be indicated with an asterisk, and all of those required fields must be filled out before the Submit to CMS button would become active. Optional fields are indicated with optional. As you can see, it'll say it's optional, and those can be left blank, or you can just always enter NA as needed. So there's a number of different types of fields that you'll see in the measure form. These initially will be free text fields, and then there will be some radio buttons and drop-down boxes. So we'll just take a look at those as we work through this measure. And then last, excuse me, the gray question mark next is going to provide some help text for you. So if you just hover over that, it'll give you, additional details on the information we're looking for. Sometimes it will give you examples of what we might be wanting to be entered into that field. So we'll just run through submitting this measure. I've pre-populated this measure information that's free text, just as a test measure information. When you get to denominator exclusions, exceptions, etc., if they do not apply to the measure, you can just enter none. But it is a required field, so something has to be entered, in that space. So this is the first field that has a drop-down box, and that is for the primary data source used for abstraction. And you can click in this box, and the full list will come up, and you can select all that apply. There's also the other, an option for other, and if that is selected, you will have another, an additional field that will pop up for you to fill out, just to enter additional information about the data source. And so that will also be a required field. If other is not selected, that extra box will not show up for you. And next is a first optional field for the CBE ID. If the measure is endorsed by CBE, you can enter the ID there, leave it blank, or again, just type in NA if you need that. Next is high priority measure. Just say yes or no. If you select no, you'll just move on to measure type. Selecting yes will pop up another box where you're going to select the high priority type. So we will just enter that. Next, measure type, you'll select just one selection there. And then care settings is next. And here you're going to select all that apply. There's also an option for all settings. So if that applies, you can just include them all that way. And then next is, does the measure include telehealth? And that's just yes or no. And then you'll see this first section, I've completed all the required fields, so it does turn with the check mark, letting us know that we're done. Next is analytics. So you're going to do the measure calculation type, if it's inverse or not inverse, proportional, continuous variable, ratio. If you do select continuous variable or ratio, you are going to get another required box that will open where you will enter your range of scores. So you can add a brief description there as needed. Otherwise, proportion, you won't have that extra field to fill out. Next is the performance rates. So we have from 1 to 10, and you'll select whatever amount applies, and that'll bring down to the performance rate description. Or if you have more than one rate, we do, this is just an example of how you could fill that out. If you just put rate 1 description and just add, however many apply to that measure. And then overall, you'll pick an overall performance rate, and we've got 1 through 10, and then also weighted or simple average, if that would apply. And do you plan to risk adjust? If you select no, you'll just move on to the next question. If you do select yes, you're going to have 2 other fields open. The first, you'll enter just a description of which score is risk adjusted, and then you'll have an area to upload your risk adjustment files as needed. So we'll just select no, and those will be hidden. Is a measure able to be abstracted? Yes or no? And then this is just an attestation. Does a measure require the use of proprietary software, devices, etc.? And that is also just yes and no. We do include that in the qualified posting, just so clinicians are aware if there may be some additional costs incurred if they would report that measure. So we finished the analytics section, and next we will move on to testing. Last year we did break out the testing into several different fields. So you'll see we'll have face validity, empirical validity, measure score reliability, and patient encounter level data element. Each of these will each have 5 fields where you can enter just specifically the different information in its applicable field. So type of analysis, testing level, sample size, results, and interpretation. We will need to have you confirm that it was tested using the appropriate data set. All of the testing fields are optional. New measures still require the face validity for the first year, and after that first year, the measure would need to be fully tested and developed. So we would just expect, if it's a new measure or an existing measure, to have the level of testing included in this form. One thing you might notice in your simplified forms, if the testing is blank, but it is a fully tested measure, just similar to last year, you can enter, see last year's testing data, or just make a short comment to let us know that it's completed, and then that's all you would have to enter for that. Feasibility, you'll just have a drop down to select if it's all, some, or none of the data elements, and then you have another field where you can add any details that you would require. So the last section is our supporting documentation. You're going to enter the link to a cost measure, improvement activity. If there is no link, you would want to provide that. You would want to enter that here because it is a required field. So you need to populate something so that it can get submitted. Reporting options, another required field. Traditional MIPS is pre-selected for all measures. If you do plan to submit it in a MIPS value pathway, you would select this box and obviously include it in your MVP tab. And then another reminder, if you're planning to report a QCDR measure that's in an MVP, it does have to be submitted in the QCDR measures. And you would also need to ensure that you upload the documentation if it's a borrowed measure. And we will we'll show you that when we get to that a little bit later. So next are the fields for clinical recommendation statement, rationale. We do require you to submit performance data every year for the measure, and any amount of data you can share is helpful. There's an option to add if applicable, you can provide a study citation to support performance gap if that's necessary. We just ask that information is within the last 5 years or the most recent. The next couple fields are for existing measures with changes. If there's any changes, just delineate what has changed with the measure, and that just helps us determine if it needs a new measure ID. And if The measure can or cannot be benchmarked against the previous performance period. This is a required field. If you do select that it cannot, we do ask that you provide additional details why it cannot be benchmarked. Discuss the citation next. QCDR measure participation plans. If a measure's been in MIPS for 2 years or more without establishing a benchmark, we may request a QCDR measure participation plan, and this is where you would enter that. There's not a specific format that's required. We just request that you provide details on how you intend to encourage your clinicians to help increase adoption of the measure. Next are the specialty or specialties. You can select all that apply, and there's an option for all specialties. Preferred measure clinical category, the same, you would select all that would apply to the measure. And then we have an optional box just for QCDR notes or any other information that you'd like CMS to take into consideration when they do review the measure. And then there's another optional area for you to upload any other supporting documentation. So at this point, I could go back and fill in the required fields that are missing, and that would activate the Submit to CMS button. Until then, it does say grayed out. And I can also just save and close, and it'll go back to the drafts folder, and I can come back and finish it at a later time. If you would want to withdraw a measure, you would select the withdraw, and it will come up a second window just asking you to confirm that yes, you want to withdraw that measure. But I'm going to go ahead and select this so we can see where I'm missing. Okay, so now all of these are showing the green circle with the check mark, and my Submit to CMS button has activated. So I can go ahead and select that. It will pop up another window with all of the information that you populated. So just another time for you to do another quality assurance check, just to make sure all the information is as you want it, spelling, grammar, punctuation, just all those types of things. And once you are good with how everything looks, you'll just certify and submit. And then we'll pop back to the main measure landing page, and we'll see that we now have a submitted measure here, and that is our test measure. So if you do end up finishing a measure and submitting it to CMS, and it's here in the submitted status, you can, up until the close of the self-nomination on September 1st, you can go back, edit details, and go in and edit as you wish. But once that self-nomination closes on September 1st, you will not have that option any longer. Same if you would have a non-active measure, which if we could edit details, and if I wanted to withdraw the measure, it will move it to the non-active folder. But I can still, up until the close of the self-nom period, I can still go back to this if you need to. Go to view details, and you have the option where you can view details. Otherwise, you would have to return it to draft status to be able to make any edits, but those are available for you. So now we'll take a look at submitting a new measure, QCDRs that are new or haven't ever been in the program, or even those that did not get a simplified form, you'll have to enter all of your measures manually. And even those that did receive a simplified form, if you have new measures to include, you will have to enter those manually. So to do that, you're going to go to the top at this Add QCDR Measure button and select that. So the first small window will pop up here, just asking you about the measure ownership. So you have the option of selecting yes, that you are the owner. No will indicate you're not the owner, you're just borrowing the measure from another QCDR, and then there's an option for co-owned. So we'll take a look at each of these individually, and whichever selection you do make will determine the type of measure form that you're going to be required to fill out. So if you select that you are the measure owner, another question will ask if the measure has been previously approved by CMS. And this is if it's a current approved 2026 QCDR measure, at which point you can enter the measure ID. And there's also a link here to the full list of 2026 approved measures to help you if you need that. If you're to enter the ID, you can then select Find a Measure, and that helps to pre-populate some of the fields if it is an existing measure. For the purposes of this demo, I'm going to select No and continue. So the measure information page that we just walked through will open, and you will need to populate, all of the same required fields that we just walked through. So this form will look the same as before. I'll save and close here. Again, you can save and close at any time and go back within the self-nomination period to edit and finish measures as you need. So for borrowed measures, I would do add a QCDR measure. And do I own the measure? No. Again, if there's a previously assigned measure ID, you can select that, but I'm going to select no and continue. So as you see, the measure form that opens is going to be a little bit different than if you were the owner of the measure. You don't have the 4 sections to populate, but you'll just enter the measure title and who the owning QCDR is. And here is where you will upload the documentation of approval from the other owning QCDR. This can be just in any format, which you've made the agreement between the 2 QCDRs. And then as a borrower, you're going to be able, you must attest that you can abstract the measure, enter your primary data sources. Again, if you're reporting it in an MVP, you would select the MVP option. The performance data is, it is a required field, but we understand as borrowing QCDRs, you may not always have that information, but any additional data that you can, input to support the measure is very helpful. Again, you'll have to enter NA because it is required if you don't have anything. Here you'll select the specialties that are applicable, published clinical category, and another area again for you to add any QCDR notes or additional supporting documentation. Again, you can save and close, or if you were able to complete all the fields, you can submit to CMS. Last is a co-owned measure, as Marlene mentioned. So again, the Add QCDR measure, And this time you will select the co-owned by 2 or more QCDRs. Again, is this an existing measure with an ID? I will select no for purposes of this demo. So when this opens, you'll see here at the top, it has a couple different fields. Before we get into the measure info, we're going to ask you if you are the primary steward of the measure, and this is just a yes or no. And then we'll have you indicate all the co-owners. And if it's more than one, we ask that you separate those with a semicolon. Just a reminder, all QCDR measure co-owners who are non-active QCDRs or other entities must be identified within the QCDR name as a collaborator and must also be listed under partnerships or collaborations in the intermediary details tab of your form. So the remainder of this form will have the same required fields that we've walked through previously. Again, you can save and close and come back, or submit to CMS if you are able to complete it. So just save and continue, and just go back to the measures landing page. So we've looked at each option that you will have with for submitting your measures, and just a final reminder that all measures that you want CMS to review must be in the submitted to CMS status prior to the self-nomination period closing on September 1st. And just one final reminder, until all are either in the submitted or non-active status, the progress button here on the left will remain in progress. So just make sure you have all those measures submitted in time. And that is all I have for the QCDR measure demonstration. So I will go ahead and hand it over to Hector for the next part of the presentation.
All right, thanks, Stacy. And I'll go through mine really quickly so you can get to some of the Q&As. And so if you pop up the next slide, which will be the QBP resources that we have available. Yep. Next slide, please. So just to go over some key websites, so as most of you are familiar with, we have the QPP website. We also have the QPP participation status lookup tool that helps you look up the eligibility for each one of your clients. We also have the MIPS Explorer measures and activities tool to also help you find the different measures and activities for each given performance period, as well as their specifications. We have the QPP resource library, which most of you are familiar with, and that's where we post the self-nomination toolkit and different resources like that for the QPP or the MIPS project. You also have the QPP webinar library. You also find previous presentations on there as well, and also have the QPP help and support page, as well as the QPP listserv, which is available on the QPP website. We strongly encourage you to subscribe to the QPP listserv so that you receive different announcements either from our team or CMS regarding the QPP project. Next slide. If you need any assistance, please contact the QPP Service Center either by emailing them at the email on the screen or submitting a QPP Service Center ticket, or by calling the number on the screen as well, Monday through Friday from 8 a.m. to 8 p.m. Please note that if you submit an email or give them a call late in the day, or when it's like data submission, when there's a lot of activity going on, please make sure that you reach out to them far in advance as possible, as submitting a ticket or a question, at 7:50 p.m. may not get answered or replied to right away due to other folks also submitting questions or emails at the same time. Make sure to email them directly. Do not forward or copy. And you must use the QPP email address in the tool line. Again, inquiries forwarded to QPP or sent via email with the QPP email in the copy line may not trigger the creation of a case number for your inquiry. And to ensure that the inquiries are routed to the appropriate subject matter experts, all inquiries must be submitted to the QPP Service Center and not the QCDR Qualified Registry Service mailbox. And processing all inquiries to the Service Center allows us for consistent tracking and helps to ensure that inquiries are appropriately assigned and processed by the PACOM's team subject matter experts. Next slide. This is just a slide of frequently asked questions. And I believe it's over to Anastasia for the questions.
Thanks, Hector. And we do realize that there is minimal time left for some questions during today's session. However, I have gone through and provided responses to all of the questions we've received so far. We'll try to tackle as many as we can, but also feel free to take a look at the responses to your questions in queue. Good news is we've only received a handful as it is, so we are good there. I'm going to summarize a couple of quick ones just to get those answered quickly. As I mentioned earlier in the call, this recording will be published as well as a transcript and the presentation on the webinar library. I did include that in Q&A as well as the chat, so you are able to access that information after the call. In addition, those helpful resources we referenced, the user guide and the fact sheets, provide all of this information in detail. And of course, if you have questions after the call, you can submit them to the QPP Service Center. And those questions will be routed to us through that channel or, of course, within your self-nomination comment field as referenced. In addition, just a couple other summaries based on the questions. If you are available, or I should say, if you do have the option to receive a simplified form as an existing good standing intermediary, those simplified forms or templates will be available within the self-nomination tool once the self-nomination period opens, which again is on July 1st at 10 a.m. Eastern. So you won't be able to see your simplified form yet, but it will be available when self-nomination opens. And I think there was one more that I could summarize easy. I'm just scrolling through to make sure we get those addressed. Oh, the review cycle. Does the review process start once self-nomination closes? I will say there is, of course, the 2-month self-nomination period. If you submit your self-nomination early in that 2 months, we will review it as it comes in. We will not wait until September 1st to start reviewing your self-nomination. We actually encourage folks to submit them early. That way, if we do have questions, comments, things that need to be updated, we have plenty of time for you to go back and do so. So please go ahead and get your self-nomination and your QCDR measures submitted early in the process, and we'll start working with you right away on that particular process. So a couple of just summarized questions we did receive. Outside of that, I'll just go back and review some of the information that we have also received. So one question does ask regarding the workflow and handling measures, should you submit all of the CQMs that you plan to support for the performance period, despite the fact that there may be changes within the rule? We would encourage you to select to report or support as many measures that are available within the current self-nomination tool as possible. If for some reason a measure gets added at a later time because of the rule, you'd be able to add that CQM or ECQM or also, improvement activities and promoting interoperability measures at that point in time. The one caveat I do want to note is QCDR measures cannot be added after the self-nomination period. Should you wish to support a QCDR measure, you do need to do that during the self-nomination period. So please make sure that you get that submitted during that time frame, as well as if you're borrowing, please make sure you get it submitted and indicate the necessary permissions have been obtained based on the conversation today. Let's see. We have received a couple of May I have the point of contact for QPP? Cynthia, can you go back to the help desk slide? Just let's have that displayed and folks can pull the email address. Right there. Oh, one more down. The email address and contact information, we'll just display this on the screen, and then the questions will be routed to the appropriate SMEs. Let's see. Are simplified forms being emailed as an Excel sheet in the past? So the simplified self-nomination form will be in the tool. So no Excels there. That's similar to what we've done within years past. In addition to that, I will note that in past years, we did collect QCR measure information in Excels. However, once that was transitioned into the self-nomination tool, and there's actually more of a tool online for it, we have retired those Excel sheets. So your QCR measures will also be available in the simplified form in the tool, just like your self-nomination form is. So you should be able to access that information there. Let's see if we can take at least maybe one or two more questions before our time frame expires. Let's see. Some of these are more higher level questions. I'm just trying to get. It does ask for contact information for folks that were speaking. We would recommend, if you do have any questions after this call, to use the contact information that is on your screen at this point in time. It is for our Quality Payment Program Service Center. All questions should be routed through that channel, as that way the appropriate CMS tracking and triaging process is in place for those questions. If questions are related to any of the topics discussed today, they will be routed to our team. So the folks behind the call today and supporting this information will definitely be the one to answer those questions on your behalf, but of course using the appropriate CMS channel to do so. With that, we are coming to one last minute here on the call. So moving to the final slide, we will ask Dr. Green and or John to make some closing remarks for us.
Well, I guess if he's not going to do it, I'll do it for him. I'd like to thank all of you for showing up for the presentation today. It's very helpful for you guys to know this is what's expected, and sometimes it changes. So, and we're able to clarify, those points of contention where folks just aren't sure. I understand, we all read the same words, but they don't always mean the same thing in our heads. So again, thank you. I hope this was helpful, and I look forward to talking to y'all later.
Thank you, John. And we do want to thank all of our attendees for attending this session today. As mentioned before, if you do have any questions, please submit those to the QPP Service Center. They'll be routed to our team, and we'd gladly respond to those. After that, we do, again, just thank you for attending. You may now disconnect, and we will have our panelists hold the line for a sub-conference.